Vallejo, the speech pathologist from Saba Senior Care in Wesco. Can you tell me a little bit more about yourself?
Yes, well, my name is Ana Vallejo and I'm a speech pathologist. I have been practicing for over 12 years now, and for more than half of my professional career I've been working with the geriatric population, managing and treating communication, cognitive and swallowing dysfunction in that population. I did attend the University of Texas Pan American undergrad and at the graduate level.
Okay. Question number 1. How do you determine if the patient really requires your type of therapy?
Well, the referral process for patient care begins ultimately with the physician. The medical doctor will make a decision whether the patient is a candidate for treatment or not. They will decide what type of therapy, whether it's PT, OT, or speech, or a combination of 1, 2, or all 3. After the patient is referred to us by the medical doctor, then we will initiate our evaluations. Upon meeting the patient and doing a patient medical chart audit, we will determine what assessment we will use to determine whether they qualify for therapy or not. We have about 5 or 6 different assessment protocols that we can choose from to determine whether the patient qualifies depending on their specific needs. Most of them are done at bedside. We collect the data from the patient. We usually generate some kind of report with all our findings, and then that is referred back to the medical professional, the doctor, and then they will read the report, consider our recommendations, and depending whether the physician can sign on that report or not determines when we will start our therapy, how long our therapy can last, how frequent our visits are, and when we need to terminate the patient care. All of that information in combination with the doctor's information, our recommendations, are sent to the payer source, which could be Medicare, Medicaid, and then they will also determine how long our therapy can last and how much treatment they need based on our recommendations.
Have you ever had a patient you were unable to help?
Yes, actually it has happened. It doesn't happen very frequently, but when I do come across a patient who I cannot help, or it is not in my professional background to help this patient, it is actually in our standard code of ethics as professionals to refer them to other professionals that can help them.
How do you get a patient to cooperate when they refuse to participate?
Occasionally we do have patients who refuse to participate. It doesn't happen very often, but when it does, we try all means before we decide that they are unable to participate in the treatment. Most of the time, if they have already made the decision to refuse to participate, if you insist on working with the patient, you will not get a positive outcome because they have already decided they do not want to participate. Usually we will give them a short amount of time to rethink the situation. We might take clinical means to decide if they are able to make their own decisions at that time, if they are competent or not. And last resort would be probably to refer them maybe to somebody else who might have another approach that could help them.
How do you gain the trust of your patients?
Gaining the trust of your patient is not easy. You have to approach them depending on their personality types. Some patients like to converse with you and talk to you and will immediately open up and tell you about their life and tell you, about their families. Other patient personalities are very quiet, they're reserved, they don't like to discuss areas like that. So you really have to get to know them. You have to approach them in a way that is specific for them. And I think gaining their trust is going to give you the best results in your therapy, because once you become their friend and they know that they can trust you and you're not going to hurt them, you have to understand that they're in brand new environments, and a lot of them might not know where they're at. They might be confused. If they see your face on a daily basis, they will get to trust you and they can talk to you and they can tell you what's bothering them. If they need any specific needs, you can address that for them. Once they know that you're not there to hurt them or question them, or because of their disease process, a lot of them are already defensive, and a lot of them are very guarded on why you're questioning them and why do you want to know where they're from and why do you want to help them. A lot of them are not used to being helped. A lot of them don't know what it's like to be treated at that level of dignity and respect. A lot of them unfortunately come from households where they might not have been treated appropriately. So gaining their trust and getting them to cooperate just happens over time. You really have to get to know them and sit down and take the time and show them that you're there to help.
How do you establish clinical relationship with other healthcare professionals?
I think that is priority. When you want to establish a clinical relationship with other health professionals, whether they be at your same level of treating a patient or even at a higher level, you come across physicians, you come across nurses, neurologists, oncologists, all kinds of healthcare professionals. The only way to really gain their trust clinically is to show them that you're reliable, that you know what you're talking about, and most of the time that you do have evidence-based outcomes for your treatment, because they can't deny anything that's clinically proven on paper.
Have your personal beliefs ever affected your working relationships with your patients?
Well, our professional code of ethics, when we're sworn into practice and we are given our credentials, our national credentialing board has its own set of code of ethics. And part of those code of ethics do remind us that if we do have any personal beliefs, whether they be religion or orientation-based or criminally based, you have to set those aside and treat the patient without bias. Now, that doesn't always happen, so our code of ethics does recommend, if you cannot treat the patient without bias, you are to refer them out to another healthcare professional who can.
Number 7, how often do you refer to coworkers for advice?
Because we treat patients using a team approach, we refer to each other in our team all the time. We talk about patients during our morning meetings. We talk about family dynamics. Regarding patient care, we talk about patient preferences. We talk about things they enjoy, hobbies, how to incorporate that into their care plans to get better outcomes in our therapy. Not only in our formal meetings when we're talking about patients, do we communicate with each other within the team, but during our treatment, we will ask what worked best for the patient, what time of day do they perform better than others, what time do they prefer to be seen, do they like quiet environments, do they like loud environments. We put all of those factors into treating your patient, you're going to get the best outcome. And not only within our rehab team do we refer to each other for advice, but we also talk to nursing. We also talk to dietary departments. We talk to, a lot of the times we have to get our social work department involved, because a lot of the times there are family dynamics involved, and different family members have different opinions on what they want for the patient. If they want to keep them in a long-term care setting, if they want to take them home. And we have to keep all those factors in mind when we're treating the patient.
How many other coworkers do you work with, and how do you maintain good working relationships?
Right now, our healthcare team that we work with, my immediate environment, I work with 6 other professionally registered therapists that I work with daily. And maintaining the best working relationship, in my opinion, is to just make patient care priority. And if you make patient care priority, all of your work will get done smoothly.
Have you ever had a bad working relationship with a coworker? If yes, how did you handle it?
Unfortunately, in a working environment with healthcare professionals, like any other, discipline and job, you're going to come across all personality types, and you will come across the person who you might not agree with. You might come across the person who you don't care for. They might be extremely optimistic or pessimistic, and unfortunately, if you're in a working environment with them, you see each other every day. That's the reality of a job. Personally, a bad working relationship, I don't let it ever get to that point. I think the best way to deal with that, if you come into a bad working relationship, is to maybe approach the person one-on-one, maybe talk about it. Maybe you might get a second opinion about that person. Maybe you learn something about them that makes them act the way they do, or say what they say, or have different experiences in you, and you might learn about them and maybe fix the problem.
Number 10. Have you ever had to deal with a coworker's unethical behavior? If yes, how did you handle it?
Unethical behavior in the workplace happens. However, the company that I work for, one of their highest priorities having to do with patient care is, priority for them is ethical care. One of our working mottos is respect, and we even earn badges at work. If you are spotted doing something right or catching somebody doing something wrong and it is brought to light, you will earn what we call respect badges, because we're supposed to treat every person, every individual with respect. And that's what our company's motto is based on, because I think a huge stigma of long-term care is that patients are treated unethically, or that patients are treated without respect or dignity. And the company I work for goes above and beyond it to make sure that that does not happen. We have continuous training, we have in-services, we have what we call like spot checks. We have people who will come in who are not identified as employees from corporate, and if they see any kind of unethical behavior happening, any kind of disrespect or indignity going on within the workplace or towards the patients, that is grounds for immediate termination. So dealing with unethical behavior is not, it is common, but fortunately where I work, they go above and beyond to make sure that that doesn't happen. So.
Those are all the questions I have for you today. Thank you for taking time and helping me complete my assignment.
Thank you.